How to correctly perform CPR.
According to statistics, approximately 3 million people worldwide die each year from cardiac arrest. The best rescue time for cardiac arrest is 4 minutes. The success rate of treatment within 4 minutes is higher than 50%. If you see someone suddenly faint, first of all, we must pay attention to the safety of the environment when discovering an injured person. First, observe left and right. Ensure that both the injured and the patient are in a safe environment. Secondly, assess patient awareness. Gently tap the patient's shoulder and loudly call out to the patient, "Hello, what's wrong with you? Wake up, wake up," to determine whether their consciousness is clear. If there is no response, call for help immediately. Thirdly, seek urgent help. Clearly designate a person to make emergency calls, avoiding unauthorized or repeated calls, like, "Someone has fainted here. This gentleman wearing green clothes. Please help me make an emergency call." Fourth, align the patient's position. If the patient is in a prone position, raise the patient's hands over their head. Legs flat. Right leg resting on left leg. Hold the back of your head in one hand. Hold the pelvis with one hand. Make the patient smoothly turn left and place in a supine position. When the patient is in a supine state, place the patient on a sturdy flat surface. To ensure unobstructed respiratory tract, do not place pillows or clothing under the head. Untie the tie. Loosen the belt. If there is a denture, it needs to be removed. When the patient vomits, tilt the head to one side. Fifth, check breathing. Touch the patient's carotid artery and observe the undulating contour of the chest. If there is no breathing and pulse, prepare to apply chest compressions immediately. 6. Chest compressions. Kneel on the patient's side. Legs naturally spread out, then shoulder width apart. Place the base of one palm between the two breasts. The other hand overlaps with the previous hand. Fingers raised, upper body forward tilt. Place the shoulders directly above the hands. Keep your arms straight. Use the gravity of the upper body to vertically press down 5 to 6 centimeters. About 2 presses per second. Keep your hands close to your chest at all times. Before pressing again, allow the chest to fully rebound. After pressing 30 times, prepare for artificial respiration. 7. Artificial respiration. Place one hand on the patient's forehead to tilt the head back. Lift the jaw with one hand and open the airway. Pinch the patient's nostrils tightly. Take a breath and wrap your lips around the patient's lips. Blow in the gas for about 1 second, causing the chest cavity to bulge. Press and blow repeatedly at a ratio of 30 to 2. Recheck the patient's respiratory and circulatory signs every 5 cycles, until the patient shows obvious signs of life, or 120 ambulances are coming. Learning first aid knowledge at critical moments. This is Ticare Health. If you like this video, please like, follow, click on the small bell, and we will continue to share useful first aid knowledge with you.
Ticare Health.